About 10 years ago, Donna Lugar began noticing some alarming symptoms that puzzled her, her family, and her doctors.
I couldn't walk straight, so if you saw me walking down the street, I looked like I was extremely drunk. I guess the equilibrium and everything was gone, and I fell down the stairs quite a few times just because depth perception and things were gone.
After multiple misdiagnoses, Lugar eventually realized she had contracted Lyme disease. And she's not alone. The number of probable and confirmed Lyme disease cases has tripled in the province. Last year, there were 155 cases. Compare that to 52 the year before and 57 in 2011. Not a surprise to this veterinarian, Lyme disease is transmitted to humans and pets from the black-legged tick, and this animal hospital has had to remove more ticks than ever.
If your dog can get a tick, you can too, and it could be them just, crawling up your pant legs, or the same way that it would get onto the dog. You just brush by. You could certainly brush by, something that the tick is waiting on.
In all, there are 6 areas in the province where Lyme disease is known to be present in ticks. That includes the Halifax Regional Municipality, prompting warnings like this at a Bedford park.
I think the key message for the public is that anytime they are outdoors in Nova Scotia in bushy, grassy, wooded areas, there is the potential for ticks and to take appropriate precautions.
As for Lugar, she's now able to manage some of her symptoms, but knows Lyme disease is something that will stay with her. She heads a patient support group and is also an advocate who wants doctors to properly diagnose Lyme disease sooner.
Very tricky, and we really need a lot more research on it and a lot more awareness. And we do need the doctors to acknowledge that it is in the province and to learn about it.
Rebecca Lau, Global News, Bedford.